Haematuria is blood in the urine. Haematuria can be macroscopic, which just means you can see it and you're aware that you're passing something in your urine. I say something because you can pass red urine or urine that looks like it might have blood in it for a number of other reasons. Commonest one being certain chemicals, and the commonest one we see in primary care is people who eat lots of beetroot. Beetroot's something that has a dye in it that if you eat enough of it can pass through both in the bowel and in the urine. So just having red urine doesn't necessarily mean that it's blood, but it's certainly something you should get checked. The other form of haematuria is what we call microscopic haematuria, which really just refers to a situation where there is blood in your urine, but it's at a low enough concentration that it doesn't visibly or easily discolour the urine. Microscopic haematuria is really a medical term we use when we've analysed a urine specimen and found that there are low levels of blood in the urine, dilute enough that it doesn't necessarily discolour the urine in any way, but is still significant because there shouldn't really be any blood in your urine, or if there is, it's really, really tiny amounts. Microscopic haematuria will be picked up by the doctor or the nurse or somebody else doing a test, and quite an easy test that can be done in the surgery using a dipstick on your urine. But it's usually not something that would be done sort of out of the blue if patients didn't have other reasons for having their urine tested. That might be because they've had previous haematuria, might be because they've got diabetes and other reasons for testing urine, or they might have some of the symptoms we talked about, burning or stinging or difficulty passing urine. Many different conditions can cause blood in the urine or haematuria. In primary care, what we do is we have a hierarchy that we would consider, because I've said many conditions can cause it, but many of them are extremely rare conditions and they're not the things we would look for first. Certainly we need to exclude important things like any form of malignancy, either a prostate or a kidney malignancy or a bladder malignancy, bladder cancer. So they're things that can lead to it. Benign conditions such as engorgement of the blood vessels in the prostate or even in the bladder more generally can cause it. But again, you'd want to investigate to make sure that it was a truly benign condition, and it still may need treatment such as an enlarged prostate. Clotting abnormalities, if somebody has some problem with their blood clotting systems, and there are a number of causes for that can cause people to lose blood into the urine, often microscopically, but sometimes macroscopically as well. So as part of the examination there, you'd look for the patient for signs of bruising elsewhere or signs of bleeding and clotting abnormalities in other places. Other conditions, a number of medical conditions particularly that affect the kidney can cause microscopic haematuria, but most of them are uncommon, and if you didn't find either microscopic or macroscopic haematuria, you wouldn't necessarily test for them at that stage. You'd been focusing on the things I've already mentioned.